So first off, I want to talk about the Movement Summit and what the purpose of it was, and then move into the identity principle of the APTA's vision model. So, to start off, the summit was a group of physical therapists that got together. That it was about 100 people that were kind of experts on movement, and the point was that as health professionals, we're supposed to aim to use well supported treatment styles and practice according to evidence. And so they got together to discuss like terminology and like, what we should use for diagnosis and prognosis and treatment and everything, so that we are kind of on the same playing field. Like we all know what we're trying to discuss and we're on the same page. So then the purpose of therapists and how we fit into the movement system is that we're supposed to be the experts on it. And so we're supposed to help others learn how to move properly so that they execute it well and maintain their health that way. If all physical therapists were viewed that way as experts and everyone recognized that, there'd be a lot of positive changes. I mean, first of all, we would be given the credibility that I think we're due. We are supposed to be, promoting functional movement and improving that in people. And so if MDs and DOs, etc., realized, and other health professionals realized that we are the experts on that, then they would hopefully refer to us more often and recognize that we're the experts, not necessarily that they are. Another thing is the patient management model and how it interfaces with the movement system. So intervention is, I think, the fourth step, I guess, in this model. And so it starts off with examination, which is, collecting or discussing all of the history of the patient and all of the other factors that we need to take in. And then the evaluation part, which is looking at all of those things and then kind of making some decisions based off of that, which then moves into the diagnosis and the prognosis, and then finally the intervention, which includes like the treatment plan and the plan of care, executing the plan of care. And so during that time period, we would be changing movement if necessary, or educating the patient on better ways to move. And so that's how it's utilizing the movement system, is we're trying to promote using the movement system to the best of our ability. Essential activities that are part of standard movement analysis. So I got two different sources for this. The first one discussed factors such as balance, strength, range of motion, and motor control. The other discussed like movements such as sitting or standing, and then moving from a sitting to a standing position, or vice versa. Walking, so floor mobility, stepping up or down, reaching and grasping using your hands. And so those are kind of all essential activities that we use in our daily lives that are going to use the standard movement analysis. So that, I think, is all.